The first question I asked was, will I see my daughter grow up? And the answer was, we can't guarantee you 10 years.
It was 1998 and Del Batten was working, running around after her 4-year-old daughter and beginning her IVF journey.
They came back and said, you have tested positive for HIV. And I went sort of, wow.
She'd been sick a year prior and her doctor had neglected a simple blood test.
Why would he? I was happily married, I had a 4-year-old daughter. I was trying to have a second child.
It was the pandemic before COVID, an illness shrouded in stigma that attacked the body's immune system. As the illness spread, so did the stigma, labelled a gay disease. With modern medication, HIV becomes untransmissible and is no longer a death sentence, but the stigma lives on.
The bottom line is anybody can be infected.
Since 2019, over half of women diagnosed in the Northern Territory and Western Australia were diagnosed late.
Among men, we see high regular testing or routine testing around gay and bisexual men, whereas for women, while testing is through antenatal screening, we also really need to see an increase in routine screenings.
Around the country, cases in gay and bisexual men have plummeted by 63% over 10 years. For women, there's only been a 6% decrease. Despite this shocking statistic, women were removed as a priority population under the National HIV strategy, instead delegated to all people living with HIV.
Diagnosed over 20 years ago, Jane Costello runs a support organisation for people living with HIV in New South Wales.
Most women are simply amazed to discover there's another woman living with HIV in all of Australia.
In her women's support groups, they discuss issues like dating, pregnancy and menopause.
Just to find somebody who understands what it means for them to be living with HIV, somebody who's been through those similar experiences, is really, really critical.
But even those larger organisations are fighting for funding, and many women in regional Australia complain they're being left behind.
It's really difficult to get the funding, and it's a vicious circle. So long as none of us talk about it, because we fear the stigma, they then say, well, how many women do you need to support?
Jane and Del are calling for a new approach.
I think if we normalise testing, we will make this just seem like a routine part of healthcare.
And for recently diagnosed women to know, an HIV diagnosis isn't the end of the line.
You won't believe this, but at the moment, all you can see is HIV. Eventually it will shrink and it will be just part of your life. That is what happens eventually, but it is always there.
Sisters in arms in the struggle against stigma. Tilda Colling, ABC News.